Good afternoon, everyone. My name is Dr. Nina Ha, and I'm the director of the Asian Cultural Engagement Center, soon to be the APITA Plus Center. I'm very excited about that. And it is APITM, so it's APITA, Asian Pacific Islander Desi American Heritage Month. And I am really, really excited to bring together this roundtable of PETAs in public health. And I would also like to thank AKD Phi or Alpha Kappa Delta Phi, which is an interest or group for I guess that began to develop in order to provide Asian American women with a source of sisterhood, leadership, scholarship, and service. Strong individuals striving together as sisters was established by co-founders Tina Park and Alice Vuong with the intention of laying the foundation for a chapter of the sorority on campus, following their belief that the sorority would provide Asian American women with a support system not otherwise found on campus. The Ladies of Sistas worked persistently to become a group that it would acquire the respect and interest from the Virginia Tech campus surrounding community of Blacksburg and existing chapters of Alpha Kappa Delta Phi. So thank you all AKD Phi members for participating and attending and supporting and sponsoring this program as well. I will start off with the Virginia Tech's land and labor acknowledgement. Virginia Tech acknowledges that we live and work on the Tutelo and Monacan people's homeland, and we recognize their continued relationships with their lands and waterways. We further acknowledge that legislation and practices like the Morrill Act of 1862 enabled the Commonwealth of Virginia to finance and found Virginia Tech through the forced removal of Native nations from their lands, both locally and in Western territories. We understand that honoring Native peoples without explicit material commitments falls short of our institutional responsibilities. Through sustained, transparent, and meaningful engagement with the Tutelo and Monacan peoples and other Native nations, we commit to changing the trajectory of Virginia Tech's history by increasing Indigenous student, staff, and faculty recruitment and retention, diversifying course offerings, and meeting the growing needs of all Virginia tribes and supporting their sovereignty. We must also recognize that enslaved Black people generated revenue and resources used to establish Virginia Tech and were prohibited from attending until 1953 through inclusive VT, the institutional and individual commitment to UPROSM that I may serve. In the spirit of community, diversity, and excellence, we will commit to advancing a more diverse, equitable, and inclusive community. So thank you again for being here and for attending. I would like to just do a very quick and brief introduction of our panelists today, and then we will begin with the questions. All right. So our first panelist is Tammy Chen. She, her pronouns, is a postgraduate research fellow in the molecular parasitology section within the Laboratory of Parasitic Diseases at the National Institute of Allergy and Infectious Diseases. Her research centers on okay, I'm not going to be able to pronounce all of these words, so you're going to have to do that for me, Tammy. So Tammy loves combining her true passion in public health with her interest in microbiology and epidemiology to address neglected tropical diseases, parasites, and maternal child health. And full disclosure, Tammy and I are also cousins. And our next panelist is Sophie B. Toe. Any pronouns, is a PhD candidate in the Department of Health Behavior at UNC Chapel Hill. Their research examines how media, arts, and storytelling can be used to advocate for health equity. Their dissertation will explore Asian American comedy and experiences of Asian American comedians in the South, with a focus on how Asian American comedy comedians have told stories about racializing and health during COVID. Let's see, and Joanne Williams completed her undergraduate degree in biological sciences from Virginia Tech, yay, an alum, in 2015, pursuing a year of service as an AmeriCorps Vista. During her service year, she advised a team of undergraduate and graduate students at VT Engage and the campus kitchen at Virginia Tech, where she focused on public health projects related to food security and Sustainability in Appalachian Communities. Deborah Wenhui Carlier was born and raised in upstate New York to Chinese immigrant parents. She began her career in operations management in the corporate world, but a trip to Haiti 3 years later motivated her to get a Master of Public Health degree. After graduation, Carlier landed a World Vision job in Asia doing development work in places identified by UNICEF as among the poorest of the nationally designated 592 poor countries of China. I could go on, but I'm gonna sort of stop there so that we'll hear more about you soon enough. And then Dr. Eileen Yam is a social scientist and public health researcher who serves as Director of International Health with the Global Research Institute Mathematica based in Washington, D.C. She has 2 decades of experience leading social science and public health research focused on gender, HIV, and sexual reproductive health in more than 20 countries in Asia, Sub-Saharan Africa, and Latin America, and the Caribbean. So we have an amazing group of people with us today, and I'm really, really excited to have them here to feature them, especially since I just realize the importance of public health, especially now, and also the significance of being a PITA at this moment in time, sort of as we transition to what living with COVID or in a pandemic still looks like. So thank you all for being here. I really appreciate it. So aside from the short biography that I shared, I'm hoping that you all can also address sort of how you got into public health a little bit further, and how do you see your public health degree relating to what you currently do? And maybe we'll just sort of what's the word I'm looking for? Just pick somebody. I'll pick somebody first and then go around. Actually, so how about Dr. Eileen Yam? Can you start us off and then you?
Sure. I'll popcorn to someone else.
Yes, please.
All right. Sounds good. Well, thank you for joining today. It's always a pleasure to speak to students. I think that's whom I'm speaking to mostly. Yeah, so I think maybe because we have several panelists who will probably have very different stories, I think when I talk to students about why public health, a lot of times the question behind the question is, well, why not medicine? Why didn't you go to med school? Why didn't you become a nurse? So maybe partly as a way of just orienting everyone to what is public health, how is it different from medicine? Maybe I'll start there. So in brief, I knew I was interested in addressing inequity. I knew I was interested in preventive behavior. So, helping people to adopt healthy behaviors, preventive behaviors before they get lung cancer, before they maybe acquire infectious ailments. So to me, the distinction between public health and medicine is that, your clinicians are working, they're trained to work with the person in front of them, the patient they're seeing in their consultation rooms. And public health professionals have basically a population community orientation. Sure, whatever might work for that one person in the consultation room as a doctor, it has to be tailored to that person. But as public health professionals, we've got to zoom out and think, okay, great. What might work for one person may not work for a community writ large. How do you devise policies and programs that will address the different needs in a community, the different inequities in a community? So right there, to me, I guess part of it also is I never did the hard science courses to allow me to apply to medical school ever. But eventually I decided that's why public health was the direction I was going to go. I got my second graduate degree when I was deep into my 30s. So I also want to underscore that it can be a circuitous road in your career, and that's really okay. So I'll stop there. And so Deborah, you're next on my screen.
Hi, good afternoon, everyone. Thank you, Eileen, for that wonderful sharing. I appreciate that. And I also agree that your career path can be a circuitous route. For me, public health was unexpected. I started, actually as an undergrad, I had no idea what I wanted to do. I think my aim was to just get a degree to please my parents and to, pay off the student loans. So it was really pretty directionless. But I started off in operations management for New England Telephone at the time. That doesn't exist now, but it's a telecommunications company. And 3 years into the job, I just felt like really my major was in psychology and concentration management, and I want to do something more human service related. So I think that first job made me realize this is, the fact that I'm rushing out the door at 5 p.m. is not a good sign. So a trip to Haiti, I had a chance to work on a summer project hosted by my church. And a lot of the activities we did were like construction work. I also was tasked with teaching math to a whole group of very young students. But the fact that we were located in the poorest country in the Western Hemisphere just really, something ached in my heart. I'll just say, I felt like I needed to do something that was more human service related. And I actually thought that I want to go to med school. So I come home and my husband's like, what? You want to go to med school? So eventually I did some searching. I took a few classes, epidemiology, biology, and stats, because I wasn't sure, whether medical school was in the next step I should take. But public health seemed to be a good kind of a merging of my experience so far. Because I learned that public health is such a diverse and vast area. I really enjoyed my epidemiology class, but I think at the heart of it, I came to the conclusion that whatever I pursued, it would have to do something with alleviating suffering, human suffering, and promoting human flourishing. And so that is really how I ended up getting a master's in public health at Boston University. And I had the privilege of studying under some great faculty members who had a lot of international health experience and learned how just a very broad spectrum of expertise can help in the area of public health. And I think I'll leave it at that, but basically that's how I got into public health. Is that okay, Nita? Okay, great.
Do you want a popcorn? Yes. Oh, do you want me to popcorn? Okay.
Popcorn to Joanne, that sort of.
Thanks, Deborah. Hi, everyone, and go Hokies. Thank you so much for having me today. So I'm Joanne Williams. I'm currently serving as the Director of Student Engagement at the Rollins School of Public Health at Emory University. And how I found public health is, much like other folks on this call, where, you grew up thinking that you wanted to be a doctor, right? And you really wanted to please your parents and just be like, you know what? You should be a doctor. So I actually didn't find public health until my senior year at Virginia Tech. I was a biology major. I was almost done with my courses, and I was working on my minor, in which I minored in medicine and society. And I took this really fabulous course called medical geography, and it was a spring semester course. This is my last semester at Virginia Tech. And at this point, I had taken the MCAT probably 3 times and just accepted. I was just not good at it. And so, I first got exposed to public health, specifically epidemiology, through that class. And I just thought it was the coolest thing. And for the first time, I was really focused on, instead of treatment at the individual level, let's talk about treatment at the population level. And then instead of, treatment, let's think about systems-based thinking, or let's use systems-based thinking in order to solve public health problems. And so I thought, for me, that was like the coolest thing. And I knew right there and then I wanted to go to public health school. Bad news is that it was too late in the application cycle to get any scholarships. So that's when I took that AmeriCorps year, where I stayed at Virginia Tech and worked as a staff member at VT Engage. And during that time, I was an Asian American woman that was working in Southwest Virginia, in the heart of Appalachia, on community capacity building programs related to food security. And so that was kind of where I got my first taste of the behavioral sciences and the health education side of public health, and the fact that, you know, even doing grassroots work and the community is your classroom. And that was something that kind of swapped me from that epidemiology mindset into that behavioral sciences and health education mindset. And so through that experience and starting those programs, in which, if for students, you could still volunteer with the Campus Kitchen today through VT Engage, it's still an existing program. That was how I was inspired to pursue my MPH in behavioral sciences and health education at Emory. But because I've worked so closely with students and in the higher education environment, I loved working within that intersection, and found that, you know, what's interesting is that in public health, a lot of people ask you, well, what's your population of interest? And a lot of folks will have a lot of different answers. But for me, it's young adulthood, young adults and college age students. And so I live in that intersection of public health and student affairs, and haven't left ever since. And so after I graduated, I remained here at Emory doing public health leadership programs, mental health and well-being and promotion programs for students, as well as leading some of our diversity initiatives here as well. And on task, Nina, I will popcorn to Tammy.
Hi, everyone. Thanks to Nina for having all of us here. My public health journey also is a little bit winded like everyone else's. I originally thought I wanted to go into medicine as well, but I had this sense that I was really interested in global health and public health going into college because of my involvement in Model UN. Actually, I was always intrigued by the World Health Organization, which is why for my college major at Boston University, I picked health science because it gave me a balance of taking those hard science classes that I needed for medical school, as well as public health courses to balance that out. But I eventually realized that I wanted to lean more towards public health, which led me to get my MPH in infectious disease epidemiology at Yale. And that's where I learned that public health is like a massive field that's not only just population health epidemiology, but I could also incorporate my interest in laboratory science. I joined a malaria lab for my MPH thesis, which is where I learned about the field of molecular epidemiology, where I can combine lab work with my interest in epidemiology and look at, I guess, the genetic spread, population genetics from like an epidemiology standpoint, as well as a molecular standpoint. And after my MPH, I still had this thought of I wanted to go into medical school. So I ended up getting another master's in medical science, where I wanted to take some more like biomedical science courses. And then that's when I kind of realized I wanted to go back into public health in the field of molecular epidemiology, which led me to my current position as a postgrad research fellow at the NIH/National Institute of Allergy and Infectious Diseases, where I joined a molecular parasitology lab where I am now. And I'm able to like combine my interest in epidemiology, work with different people in my lab, and learn a lot about public health and addressing neglected tropical diseases. And I guess I can just bump to Sophie.
Thank you. Yeah, my name is Sophie. All of y'all's like journeys to public health are so cool. So I'm really excited to share mine with you too. So basically, you know, in high school more than a decade ago, most people didn't know that public health was an option, and so I was very much your classic, like, I like science, I want to make a difference, I want to help people, all that. And so I came into college being like, okay, this is what like a pre-med would do. So yes, like everybody else, I was also pre-med for a little bit. And so in college, I majored in molecular bio, as well as medicine, health, and society. And I really enjoyed my bio classes, but I found myself being drawn to student organizations like student newspaper and also the humor and satire paper. I was also drawn to classes that talked more about like systems and media and policy, things like that. And I also fell into research in social determinants of health, and more I just became attuned to and like interested in the context that people live, work, and play in, and how that context has like a profound effect on people's health. So I was like, okay, maybe I'm more interested in this and less interested in being like in the day-to-day of like being a clinician. So I was like, let me explore that. So after undergrad, I worked at the North Carolina Community Health Center Association. So I grew up in North Carolina, so I was like kind of going home. And so I worked in community health, and I was an intern and then became a data analyst, which was really still a catch-all for like, I was really lucky. They just let me do whatever I want and explore like anything I wanted. So I was able to like go to the state, like the General Assembly, and like advocate for like community health centers. For example, I worked on like data visualizations to like use on like policy briefs and things like that. So all that was really cool to me. And I knew that I wanted to continue this line of work, but I still wasn't quite sure like what my niche was going to be. So I went and did my Master of Public Health to continue exploring this interest. And actually Tammy and I did our degree together and like became besties. So shout out Tammy. And during my Master of Public Health, I researched body image, and I also like continued some of my community health work, like in the local community where I was at. And then that led me to my PhD now. So I'm a fourth year PhD candidate at UNC. And my dissertation is hopefully going to look at how Asian American comedians have addressed racialization and health in their art and their comedy, especially during the COVID era. And then some of my other work also focuses on like health equity in public health curricula. So just broadly, I have like an interest in storytelling, arts, and media as part of health advocacy, because I believe that stories provide like a nuance that can't just be captures in numbers alone. And so uncovering these like invisible stories can then generate hopefully like strategies for change. So yeah, I'm really excited and lucky to be here.
Thank you, all of you. I have sort of individual questions for each one of you before we start it, and then moving on to general questions again. So Sophie, your work as an aspiring comedian is also really incredible. And so I was wondering, how have you made that part of your life relevant to getting your doctorate in public health?
Yeah, well, first off, I'd say I'm more of a retiring comedian than an aspiring comedian, but this PhD, it'll really take it out of you. But anyway, so that storytelling aspect I was really going on about. I think that like I've always just been like in high school, like people just laugh at things I say. And then I was like, oh, okay, I guess I'm funny and they're not just laughing at me. So I was like, okay, let me be funny in college. So then in college, I went and worked at this humor and satire paper at my college. And then I really enjoyed that. And then I was just like, and then I think because I did that, and then because I was doing the like journalism stuff, and then I also like briefly worked for like this magazine. It was actually the American Medical Student Association magazine. All of these like ways of storytelling, I was like, oh my gosh, I really love this. I really love communicating like health and science like topics to the public, or like to whatever audience I was communicating them to. And then I think all of that together, and then just my general interest in humor, just and the ways that like satire can really like be used to like subvert people's assumptions and to like tell these stories that may not otherwise be told, I think is really important and can be like have a lot of potential to be used in like health advocacy. And also like we see in all these like, you know, comedy films, especially like a lot of like new Asian American led like comedy films in the past few years, they touch on like these really like heavy like, you know, topics of like mental health and like family and like intergenerational trauma and stuff like that. And so I think humor is just like a really interesting vehicle for delivering like health related stories, as well as like for I guess like uplifting people's stories and encounters with the healthcare system that might otherwise not be made aware to the public. So yeah, basically that. I also like have still like on the side like run like a satire and humor like website with my best friend, who's actually a professor, and she does like psychology and like early childhood development and education. And so the two of us like in our own like comedy, like sometimes we'll just like we'll touch on like topics of like health, or like being like people of color in academia and things like that. So it's like both a way for me to cope with my work as well as like incorporate it into my work. So kind of pervades like all of it.
Thank you. If you could possibly put the name of your website into the chat for everyone, that would be great.
Oh my gosh, yes. It's entirely on Instagram now. So if it's,
Okay.
yeah, so hopefully it's easily accessible to everyone.
Thank you. And I'll loop back later to ask you what recommendations for movies that you recommend regarding your topic as well. So moving forward, Tammy, you've gotten quite a few master's degrees in public health. And what have you learned from your various programs you attended, and what stands out about getting your degrees? Also, could you please describe your job now at the NIH a little bit further?
Okay, thanks, Nina, for the questions. So with my MPH, I think what really stood out for me was looking at infectious disease from not a clinical standpoint, but from like an epidemiology standpoint, because I have a few friends in medical school, and of course they learn about infectious disease as well. But from medical school, like they just learn like what the disease is, what are the symptoms, and how to treat it. But what I was interested in was like the transmission dynamics, how to prevent the disease at a population level, how does it transmit, and how does it affect people, and how to prevent it. And learning about the different life cycles of the diseases was really interesting to me, because we can learn about how to create interventions at each life cycle disease. For example, like malaria, there's like the mosquito vector, but there's also like the how it gets transmitted, and also learning about how to prevent the infection in mosquitoes before it gets to humans. So that was really interesting to me, and what stood out compared to my other master's classes, which was more clinical based, clinical implications and how to address it from like that standpoint, versus learning about like the deep intricacies of how to prevent it, what are the transmission like. And at my job, I'm able to really understand the transmission aspects of it. So I'm in the molecular parasitology section within the laboratory of parasitic diseases at the NIAID. And what my role is, I'm part of a group of researchers that it's a partnership with the Canadian government, actually, where we look at the dairy industry and looking at parasitic diseases that infect dairy cattle. And we look at how some parasites cause fetal loss in dairy cattle. And I'm interested in looking at how these parasites cause these fetal loss cases, and also screening these cows for all the different parasites that infect them. So I get a lot of samples from the veterinarians that mail these over to my lab, where I basically screen them for all the different parasites that we find. And we actually have found a lot more than veterinarians anticipated. So we found 4 different parasites plus a bunch of different new parasites. So that's really exciting to see new parasite species. And my other part of my project is I look at marine mammals. So a lot of endangered marine mammals with partnerships with veterinarians in Alaska, as well as different parts of the Pacific Northwest. And because of my interest in maternal health, I'm looking at cases where there's like fetal loss and like transplacental cases and congenital cases. So I look at different parasites there. We work with like the Marine Mammal Stranded Act, where we get cases that were animals that were stranded, found on the beach, or died in veterinarian care. So it's really interesting to do like conservation work at the NIH, because it's not entirely human health related, but it is very, I guess, fun health, because a lot of these parasites also infect humans, such as Toxoplasma gondii. It causes a lot of devastating impacts in humans, and it's one of the neglected tropical diseases. So by learning about how they infect marine mammals, we can also really learn about the pathogenesis in humans. So the work is a lot different than what my colleagues are doing in my lab and like within the NIH, but I find it really interesting looking at different species and like seeing the broad impact that these parasites have.
I've seen the slides you send me or share with me. It's quite fascinating. Next, thank you, Tammy. Next is Joanne. What have you enjoyed about your work at Emory in your current position within both the School of Public Health and in the context of student affairs, which is always, it's sort of an interesting sort of intersection? And then what has been challenging about this role?
Yeah, thanks, Nina. So in terms of what I love most about my role is that every day is different. With students that are here on this call, like in regards to student life, just there are stressful periods of the semester, and then there are also like really exciting periods of the semester. I'm thinking about April at Virginia Tech with, big event. I'm also thinking about, the International Food Week that's happening, or Food Fest that's happening that Nina was talking about earlier, and knowing that it could be celebratory times, but there is also, like in student life, there's also tough times as well. And so, in my work, as it relates to public health, I feel like, I am so glad that instead of epidemiology, even though I love epi, I chose a concentration where I'm able to apply a lot of the skills that I still use every single day here. A lot of our student life work and student affairs work here at the Rollins School of Public Health is very data-driven and evidence-based, as they always teach us in public health. And so I really appreciate having a lot of the creative freedom to, kind of work with our faculty and some of these content experts in developing programs for our students that relate to, their mental health and well-being, that relate to nutrition, that relate to, some of these, key health issues or topics that might be of interest to students, and kind of planning them strategically depending on, what students might be going through. So for example, if midterms are coming up, like I know that students might need a session on stress management, or I might need to work on a workshop that has to deal with imposter syndrome and things like that. So it's been fun to kind of explore a lot of these topics. What's also interesting about being in the field of student affairs and higher education right now is that a lot of universities are also investing heavily into student health and well-being right now. And so when you think of public health in these different industries that my colleagues are working at here, like thinking about government at the local, state, and national level, thinking about nonprofit and for-profit organizations, academia and higher education is actually another industry where, there's a lot of public health money that's coming in. And so working in this sphere of, in this intersection of public health and student affairs is exciting, because we're almost creating these best practices that will be part of an institution forever. I'm part of a strategic plan of an institution. And so with that said, if there is anyone on this call that is interested, students and panelists alike, that's interested in, coming into that university space, know that there's likely going to be a lot of jobs available in the future, because student well-being is extremely important. Now, in terms of challenges, and it's interesting, because when you think about things that are happening outside in the world, things that you see on social media that might be triggering tragedies, national news that might affect communities, the university is also a microcosm of what's happening in the world. And so I know we'll talk about this a little bit later, but being an Asian American woman and a leader within the school, and having that identity and carrying that with you can come with challenges, because there is not enough representation yet. And oftentimes that burden falls on you to be able to respond and to support students that might look like you. But I'm hopeful in that will change in the future as we think about increasing representation and university leadership. And also just those stressful times of year, like when students are stressed, we are stressed too. So just know that we also feel it with you, that we are riding this journey with you, but we're always here for you. And that's something that I always like to tell my students as well.
Thank you, Joanne. That was very useful. Dr. Yim, your background is in global public health is really astounding, like all the countries and places where you've been. In terms of that, what is the importance of understanding this area of global health, like especially since it's so rich?
Yeah, well, I think what COVID has taught all of us is viruses really don't care about your borders. So if nothing else, if you care about the global community and population, if you don't understand and collaborate with people, governments, agencies, researchers across borders, which some countries, in fairness, do much better than others, you are really handicapping yourself and your own response. So we can dissect till the cows come home what we have all done wrong in COVID, both at the interpersonal level, policy level, global level. But yeah, health is inherently global. And I think not even just in terms of physical health outcomes like COVID, HIV, infectious disease, but the kind of values and training and thinking, to the extent that everyone, whether you're in Zambia or in Myanmar or Honduras, to the extent that these countries are self-sufficient on par with the high-income countries in terms of their public health apparatus and surveillance, that's the North Star. That's what we should be heading for. So that motivates me. And next, on a somewhat self-interested level, I think when you work across countries, you train a really different eye on your own country, not only what we're doing well compared to other places, but where we clearly fall down. It's staggering to other countries how we don't have any such thing as a public health facility. The government-sponsored health facilities, we just don't have it. We don't have a safety net. That blows everyone's minds around the world. How is it that Lesotho does and we don't? And the other is where we do things much better. We register every single birth. We register every single death. And that sounds like a minor thing, but imagine if you're a girl or a woman who doesn't have any identity card. You go through life literally being invisible. If your husband dies, you have no rights. You can't prove who you are. You can't prove that you're entitled to his land or whatever it might be. So I think that's very edifying as well and very enriching to just become much more critical about your own country and what lessons you can learn from how Americans do it and where we really fall short.
Thank you. That is really just illuminating, I think, to also think of it more broadly. Debbie, well, while you have a degree in public health, I know that your trajectory is different than the rest in a bit. Could you please share your experiences and background more specifically as it relates to public health?
Sure. Well, I guess I'll just kind of continue where I left off. After getting my degree in Masters of Public Health from BU, my husband and I had an opportunity to go overseas. And so we've always wanted to do cross-cultural work. And so that landed us in Hong Kong. And while I was in Hong Kong, I was really genuinely looking for an office job in Hong Kong. And somehow I landed a job in China without going into all the details. I actually worked for World Vision in the Hong Kong office, but I was hired specifically to be the health coordinator for their maternal child health programs, as well as the manager of their income development projects that span income generation, water resources, even literacy. Just, I guess the lesson I learned there is that if you're gonna go in to help a community or a country with their health problems, identifying their needs, it's so much linked to poverty oftentimes when you're in the developing world. And so you end up moving into other areas like income generation, and because you're thinking of how to sustain the health components of your project. So I think that for me, public health activities for my first job was mainly to go into some of the poorest counties in China and figure out what the needs were in a specific county, and also identifying a county that had enough infrastructure where we could actually have an impact, because World Health, the World Bank, I think UNICEF, they all came in to try to, this is like many 20, 25, 30 years ago I'm talking about, so I'm quite old. So, but there was a lot of, I guess, support in terms of donation of equipment. I would walk into hospitals and you would see all this state-of-the-art equipment and just nobody else. There were people running, even though the equipment was distributed to all the maternal child health units and also to the county hospitals. There was just no trained personnel, no medical personnel. So I think that the voluntary organizations realized it quickly that they had to work on the soft part of public health. Like, we need to bring in people to train up the barefoot doctor, the village health doctor. So a lot of my work in this first job was doing baseline surveys, rapid assessment planning, and then determining what type of project we could put in and how much money, we should put in, budgeting and financing of everything, and partnering with other government agencies like Australian government, as well as UNICEF, and coming together and trying to come up with sustainable development projects. I think in my, the other position that probably also in the international health arena and more of a global health perspective, a little more removed from the grassroots, was the malaria project that I somehow got involved with that was sponsored by the Bill and Melinda Gates Foundation. Virginia Tech, I was working at Virginia Tech at the time, and actually in the Bioinformatics Institute. And there, while I was there, a professor in the entomology department asked whether I could help write a management plan in the public health part for this proposal that he was putting in. And I said, sure, why not? And then he said, like, if it gets funded, can you be the program manager, the project manager? And I said, yeah, but I really thought that there was no way it would be funded. Well, lo and behold, it was funded. And we were able to spend like about 5 years working on an insecticide that was safe and target specific, that would stop Anopheles gambiae, like basically turn off their nervous system. So again, public health I was getting involved more of like the research end, like Tammy, is involved with this. I find it fascinating, pathogens and parasitology. Again, I guess my message is that public health is so vast. So you can be involved with health education like Sophie and Joanne, and you can be involved with the population studies, and Eileen's work is magnificent, just having this global view of things from her data analysis and also how that impacts policy. I think that's fascinating. I think the other area of public health that I kind of was involved with was with the Bioinformatics Institute. In that regard, I was actually using more of my operational management skills to come alongside faculty members who were doing work like on mad cow disease, or like influenza A, or at that time SARS and coronaviruses, and so I think I guess the message I wanted to share with students that are listening in is that public health is such a vast area. I think it's most important to find out, to understand what you want to do with your life and your overall goal. But public health is an amazing area to pursue, because I think it just borrows from so many expertise. So if you're considering public health, please realize that it's not such a big jump, actually, because I feel that if you have certain work experiences or skills that you've learned from your undergraduate degree, they're easily transferable.
Thank you, Debbie. I really appreciate that. And so moving sort of like the transferable, and then I'm going into this sort of really identity-based question, is another reason why I asked you all to participate in this roundtable is due to your identities as APIDOs and as women. And so what does it mean to bring your identities into your work, and why are these identities so important to share? And Joanne, I know you touched upon it, so I figured I'd let you start and then you can popcorn over.
Yeah, absolutely. So, I mentioned that, the university and, the people that you work with, regardless of what area of public health that you work with, like whatever the communities that you're serving, the communities that you're learning alongside from, you're bringing your identities there, whether you are aware of it or not. Having been in, having worked in the communities in Southwest Virginia and the New River Valley, being an Asian American woman in Southwest Appalachia, I came in with my own biases of like, oh my gosh, am I going to be discriminated against and things like that? Like, I'm a person of color coming into these predominantly white spaces. And something that that I've learned is that they didn't really see my color, but they saw me as a person from the institution. And so while we're also a PETA identifying folks here on this call, we also have these other identities that kind of create who we are. And so there's also these intersections and things that we also should acknowledge as we're working with communities in public health. So that's one thing that I'll say. But I did also mention, having been or having worked in the university space as an Asian American woman, when people think about Asian American women, they're like, you're either a doctor, a lawyer, an engineer, or whatnot. You go straight to the stereotypes in which your parents in which it's what your parents wanted you to be. But an educator, that's not something that's common in higher education yet. And so, for example, one of the times where I felt like my identity really came into play was actually, and trigger warning, I'm going to mention shootings. Going to give folks a moment here. If you need to take a break or take a step out or things like that, feel free to do so. Just respect the space here. But when the Atlanta spa shootings happened right here in our backyard in Atlanta, it was actually down the street from where I lived. And I was also working in the university at the time. And so being the only Asian American woman that's in leadership here at the school, I was kind of going through my own emotions and processing, but also had to kind of put that aside and also kind of respond appropriately, right? And respond to my students in terms of how should I support them? How should I, what are some of the things that we need to put in place in terms of safety, counseling, things like that. And so, and it was also working with leadership to ensure that these things were put in place in a timely manner, and that a statement was also released from our institution addressing the situation. And so when you're in that response mode, people are almost kind of relying on you to almost do something, but also to inform it in a way that so that we could respond appropriately and with cultural sensitivity as well. And so that was kind of where I first, saw myself for the first time, like, oh, this is also me in space of higher ed, where I'm really advocating for people that are in the APITA communities here. And while that was very difficult, I'm also really grateful for that experience. And I think students really appreciate that. And the communities that you're serving, they really appreciate if you acknowledge your identity and just kind of come forward with that vulnerability and acknowledge how you arrive into that space as you are, whether or not you're an administrator. I think what's really important is to be authentic and as transparent as you possibly can within your limits, right? But that's something that I've definitely learned being in APITA. And it's also interesting because, we also grow up not wanting to advocate for ourselves, keep your head down, don't say much, but when you're in this space, you have to say something, right? And so that's something that I was initially scared of, but I'm not scared of doing that anymore. So do I popcorn, Tammy? I'm going to ask, because I know this is a really vulnerable question, so I'm just going to ask who wants to go next. I'm not going to put anyone on the spot.
I can just go then.
Yeah.
Okay. So I'm in like the very like laboratory STEM kind of side of public health, and the majority of the people who are especially in leadership are like older white men. So like when I joined the NIH, I didn't really know what to expect. I expected like a very male dominant field, and like my laboratory branch itself is very male dominated, but my lab is actually all female except for our PI. So it's a very like interesting to work with like senior female scientists and then learning about what their experiences are. So like I really enjoyed that. And another unique part of especially like my lab is that everyone is actually like, they're all from different countries. So they all came from Brazil, Argentina, Japan, a lot of different countries to study and train at the NIH. So I get a lot of different unique experiences from all the different scientists in my field. So it wasn't like what I anticipated, because like, I guess I had this stereotype for my lab, but I really enjoy it. And it's really cool to learn from like other female scientists in my lab. So it's a little bit different than what Joanne said, but I guess you never know what to expect. And I guess whoever wants to go next.
Maybe I'll just add sewing together both Joanne's and Tammy's perspectives. You know, to me, it boils down to whether you're talking about student services in higher ed, whether you're talking about hard sciences and labs, or crossing borders and going into other places. To me, it's representing yourself, your country, your field, and having people in the furthest reaches of Tanzania or Vietnam or wherever. People like me who look like me are Americans. One, a lot of people don't believe that I'm American, certainly not in Africa or Latin America. I practically carry around my passport sometimes, just because for better or for worse, being American carries a certain prestige and credibility in some professional circles. So that's one, just representing Americans look like me. They don't all look like Tony Fauci, for example. And then the other is just having the self-awareness to know, as much as I critique my own country, other countries are far less sensitized and evolved. The kind of treatment and blatantly racist things that I've heard in some other countries, particularly lower income Black and brown countries, they're much more egregious than I would ever tolerate in the States. And having the grace to say, you know what, I couldn't expect you, not having seen much representation in your media, in your social circles, to know that's actually kind of messed up to say things like that, or actually people who look like me can actually be your boss. That's something that I see value in, as hard as it can be. I think part of it to me is by representing, you're fighting a broader, bigger fight. And that's what motivates me.
I can go next. I think similarly, just kind of to echo one of those points, like whether we like it or not, or no matter how hard we try, we bring our identities to our scholarship, even if we think that, so there's no such thing as like objectivity in any sort of research. And so, our identities influence the research questions we ask, or what we're even interested in generally, and like what matters to us, how we interpret and analyze data and draw conclusions. And so, for example, like what made me interested in Asian American health is, I am Vietnamese American. I'm also interested in queer studies, because I am queer. I'm also a Southerner, so I focus on Asian Americans in the South, where I was born and raised, and my parents are also former refugees, so I consider those angles in my research. And then importantly, I also try my best to consider my position in relation to others. And so considering that I grew up middle to upper middle class, considering my own internalized anti-Asian racism and stereotypes, such as the model minority myth and the perpetual foreigner myth, and also considering the anti-Blackness and settler colonialism and white supremacy and ableism that has benefited me, and making sure that I try my best not to perpetuate those through my own work. And then also importantly, like I said, I am interested in Asian American health in particular, and there is no advancing of Asian American health if Asian Americans are not at the table. And so knowing that I'm very nobody knows our experiences like we know our experiences, and so it's important to have those voices at the table who are like actually the people who are who we're saying we're trying to help. And I also find it, I'm really proud of the fact that I'm like doing this work. And also, again, like Asian Americans, like we are not necessarily obligated to study Asian American health. It's definitely just enough of an act of resistance to be surviving, like, you know, and so we don't have to do this work, but I'm really excited to be in this work because I don't think I can name a single professor in my school of public health who focuses on Asian American health. Despite Asian Americans having like the largest income gap of any racial group and like lots of disparities among Asian American groups and also in comparison to white people, you know, anti-Asian COVID violence, lack of access to culturally appropriate healthcare, and like stigmatization of like our medical practices and health practices and of our foods. And so all of this, and given my like identities, I am just like always like reflecting on those identities and how I am positioned like at the table is always really important to consider like throughout this public health journey.
I guess I'm last. I have to say that I did not really think too hard about myself as an Asian American at the table until I started working in higher ed, especially in the dean's office. Then I started to think harder about it. I think it's probably because a lot of the projects that I was involved with were, you know, involved international collaborators. So I just found it a much more gracious group to work with, and issues didn't ever cross my mind. So although I would say I agree, I can identify with Eileen, like traveling in China and people looking at me and not knowing that I'm American, you know, just assuming what are you must be like Singaporean, Taiwanese, or not, I think Singaporean or Japanese, I think I would, or Korean, but not I had an accent with my Chinese, so, but not American. There would be no, you know, nobody ever guessed that I was an American when I got into the more rural areas of China. And I think that when I was working on the malaria project, we had a lot of African colleagues and just actually very international group, Russians and Americans. And I felt that just didn't really think hard about that. It was my last job, which was not even a public health job. It's Director of Research of Strategic Initiatives and Engagement for Research in the grad school, graduate studies in the College of Engineering. And so it's, you know, completely different, but I was working there when COVID hit, and I was definitely, my radar went up, because when anti-Asian hate and, you know, violence was happening, I noticed that my colleagues were totally clueless or unaware, right? And of how I might be feeling, or faculty on campus were feeling. And because I think there's a lot of focus on students too. I mean, maybe there was a slight interest in, how are our students doing, but it affected faculty as well. So I really learned at that point that it was important for me to speak out, because I think I was responsible for getting our dean's office to issue a statement of saying that we're, we stand in solidarity with our Asian community here, because hours went by in days, and I'm like, wait, when are we going to say something? We're the dean's office, we need to say something. And I think that through Nina's help too, there was a lot of, I think she was really great at mobilizing communities to speak up and to help understand that Asians have mental health needs too, and this is really happening. So I also feel that this whole idea of Asians being invisible, I definitely had a chance to think more about that throughout my career in this last job. And I think that because of my age, I decided to be much more visible and vocal at meetings that I was at. And that actually helped just, I don't know, help break the ice a bit. But I think, I think one thing I've learned is that for myself personally, that I actually had some, perhaps some suppressed situations where I was feeling invisible, or just not considered as important in some work situations, depending upon it was really dependent upon the position or the company I was with. And it wasn't until the pandemic hit that I really started thinking about those situations and the need to speak up. I did find that colleagues sometimes are just not aware. It's not intentional, and that it's just important to kind of, with some sensitivity, it takes courage to speak up, because you think, am I crazy? Like, like, why isn't it? Why am I seeing some things that they're not seeing? So, so I'm proud to be Asian American, a PITA, and I'm proud to be a woman too. There are other issues there that I won't go into, but yeah, it's important to speak up.
Thank you. I know you've been doing this throughout the entire roundtable, but can you think of any advice you would give to people who are interested in going into public health, or in some way, shape, or form? One last piece of advice that you think might be beneficial. Sophie, you were nodding, so I'm gonna.
Okay. Oh shoot! What just happened?
Hold on. Is that better? There you go. You're muted now.
There we go. I'm very sorry. So I was just gonna say, literally everything is public health. And so, I've like done jobs, and so I'm like doing oral histories right now. And I just actually sat in on a class today where the students were examining oral history interviews. And this is not a public health class, but the students were examining oral history interviews with veterans. And one of the things that came up was that veterans often get their social support from older veterans and not support necessarily from programs that are supposed to help them, because the US loves to say support our troops, but then there's not actually any support for veterans at all. And so, in the field of public health, like this is useful to public health to know like how people get their like mental health support, how they're coping, and like who's around them. And again, this goes back to like the storytelling aspect of like, it's really important to get people's stories. Anyway, that rabbit hole aside, yeah, basically like anything is public health. I would also like recommend, like, to the extent that you can, like advocate for yourself to get paid for your labor, because often, like, especially as like Asian American like women, or like I think people think that they can just like walk all over us or ask us to do this and that and like kind of tokenize us without actually just like fairly like compensating us or considering that we're performing a lot of like emotional labor. And so advocating for that. And yeah, I would say just go for it. And like, definitely, like, if there's like don't be afraid to like cold email people, or if there's like an organization, or if they're like professors or like mentors in your network that you want to connect them with, it like wouldn't hurt to just like reach out to them, because the most they could do is like say no or just like never respond to you. But yeah, I can also like drop my email in the chat too, like for anyone who like wants to talk further about public health or anything.
Thank you. Who wants to go next?
I can definitely echo Sophie and what others have mentioned in the call, is that, and public health is like a club, anyone can join and anyone can get involved. And what's really cool is that the field, as I've mentioned, is just constantly changing. Like, I graduated from public health school 5 years ago, and I would have never thought that art like that art, like being a comedian, oral histories and things like that, that was not a thing like in our courses, but now it is. Like it's another form of qualitative data that we could use as we kind of learn about folks' experiences so that we could properly address public health issues. And so it's also a really exciting field. It keeps you on your toes. And that like, it also allows you to just kind of also work like with a lot of wonderful people that are different from you. And so, you know, the one thing about public health that I would also mention as you're considering the field is that it's extremely collaborative. So, well, it's systems-based thinking, but it's also very collaborative. You'll work with a lot of stakeholders in community, in a lot of different agencies or whatnot. But regardless, in those spaces, again, you're going to be advocating for the public health causes and issues that really call to you. Another thing that I'll mention, if you're considering public health school, a master's of public health or a master of science of public health or a doctoral program, whether that's a PhD program or a DRPH or a Doctor of Public Health, feel free to go and explore some of those application processes early. And kind of map it out if you're interested, and map it out in terms of your professional timeline as to when, if you are pursuing, or when, or if you want to pursue school. A lot of those deadlines, or a lot of those applications have deadlines for merit scholarship considerations. So just also note when those would take place and if you decide to apply to public health school. And also all the public health schools are great. And we all work together very, very closely. And it's just a matter of finding your research interests and the priorities that really call to you. So if you have any questions, I'll also put my email in the chat. I'm also a part of the Association for Schools and Programs in Public Health for the Student Services section. So I also work with a lot of my other colleagues in other institutions very closely.
I can go. I think if you're interested in going to public health, that's a good career goal. I think if you're interested in aiding in human flourishing, which I think most people can connect with, it's also a great career to pursue. I think that as long as you have that big vision, you can find a way to plug into public health. I would, if you're just still not sure, I would really advise taking a class at a school of public health, or a lot of times there are evening classes you can take. You can take epidemiology class, but you can take a health education class. You can take international health class. You know, I don't know if you're into biostats, you could take that. Also, you can probably attend a lecture, you know, that is, you know, a professor is giving in health services or in, I'm trying to think of different areas, health education, parasitology, nutrition, or yeah, definitely, it runs the gamut. I would say that it's probably good to also take a look at where you are now. Like, I don't know, you know, you may have had classes, courses that you've taken that you gravitated toward. You know, take inventory of those areas that you're passionate about and see how that can relate to a, you know, a graduate degree, whether it's a doctorate or a master's degree. Because the field is so wide, I felt lost going in. Like, I felt like at a disadvantage. I don't have a nursing degree. And there are people sitting next to me in my classes that are doctors and nurses. Some were development relief workers, some were government people, policymakers. You're gonna find a very interesting set of classmates and peers when you go, if you decide to go to pursue public health, and which makes for a very interesting, like communal learning experience. So you bring things to the table as well. I would say that if you're interested in international health, oftentimes that there are even different avenues you can take in that, in financing of healthcare, health services, delivery of health services, health education, more like population studies. It runs the gamut. So yeah, That's the advice I would give.
Sammy?
Okay. I think everyone touched on like what I wanted to like provide for advice, but like Sophie said, public health is everything. Like whatever your interests are, you can apply them within the field of public health, ranging from like social behavioral sciences to like what I'm doing now in molecular biology. But if anyone is like interested in learning more about the molecular side of public health or molecular epidemiology, I'm like more than open to talking with anyone, or if anyone wants to learn more about post-baccalaureate opportunities at the NIH, I'm also willing to like point you guys in the right direction. So I'll drop my email in the chat if any of you want to reach out to me.
Thank you, Dr. Yam.
Yeah, I was listening to everyone. So when I was in my Master of Public Health program, one of my advisors said she thought of it like the miles per hour degree. The MPH actually stands for miles per hour because you can get so much mileage out of this degree. If you have a burning passion for, let's say, safer abortion, access to safer abortion, policy advocacy. There are advocates and activists in this country, around the world, working in that space. If you're interested in evidence and generating research and learnings, it's in such short supply in some of our rhetoric about health issues these days. It's a really big headwind a lot of us face in this time when truth has somehow become subjective. Epidemiological data somehow has become subject to contortion and just misinterpretation. So I think that if you're interested in how do you communicate research, how do you distill really technical information down into language the rank and file people in different communities understand and trust, fundamentally trust, that's what public health has to offer you. I'm a data nerd myself, so I am a researcher. I like to do my randomized controlled trials to see if programs are working, are they reaching the people they should, and documenting, why is it that this predominantly Black community has a testing site where all the people showing up are actually white people from across town? What went wrong here? Whose perspectives weren't heard here? So I think that sometimes it helps starting with what's the fire in my belly, what kind of either makes me angry, excited, and then from there, there's probably an avenue for you. And health doesn't just mean physical health, it means just well-being. I usually use the word well-being writ large, whether that's mental health or whether it's parents not being strung out with little kids. It pretty much can encapsulate whatever you want it to be.
Thank you. I was going to ask my last question, but I actually wanted to see first whether or not people in the audience had questions. If you can put it in the Q&A and I will read through it. But if you could do that, that would be great. And then if not, I will ask my final question to the panelists. Or if you, or you can also put it in the chat if you need to chat with the hosts and panelists. Anyone? Well, I'm waiting. My last question to you is actually an interesting one because it's basically, what is one question that you wished I had asked but didn't? Or what is maybe another way is also, do you have any questions for each other that you would like to sort of kind of know more about? Any burning questions?
Nita, can we pose a question to the faceless, nameless participants?
Sure.
So when we do these talks and scientific conferences and professional meetings, you often set out up front, okay, what are you hoping people get out of this? And I think I set the bar pretty low sometimes, but I'm just curious, is there a way to suss out, did anyone learn anything new today? Because if the answer is yes, I feel like, okay, we did our job. This is a good use of our time. And then if there are any follow-on questions, I always enjoy hearing what people want to hear from us.
There are two questions. The first is how to get started on finding internship opportunities within the public health field. And the second one is, do you have any advice for networking in the public health field when you are not already in it, like it is not currently your major? Good questions. Anyone want to tackle?
I can answer that. I remember I did have a couple internships. I think if you enter a degree program, then usually your professor is a good place to start. I got to work as an intern for the American Public Health Association for the president, and specifically tasked to help write up his column. So sometimes you can find like policy work or like, so that's one example. And that was through a connection I had with one of my professors. And then I got had another internship through a professor working for the Massachusetts Department of Public Health. And in that job, I was working for the Division of Refugee and Immigrant Health, and was able to work on like a policy and procedure medical interpreter services guide, just editing a proposal for funding for substance abuse services for bicultural workers. So a good place to start is your professors, or you might even be able to, I don't know, engage the American Public Health Association. And I think they must have like job or internship positions listed somewhere, but someone else can answer that.
Yeah, I can definitely also go. So in addition to student engagement, I also work very closely with our career team here at the School of Public Health at Rollins. And so, you know, Deborah also kind of hit the nail on the head. Your faculty, whether or not you're already in the field or not, or even if you're just considering a school or program in public health, those are really good folks to reach out to. They don't bite, and they actually really love talking to prospective students, especially when they're kind of considering going into this into this field. And so as you enter, you know, if you're considering a school or program in public health, you know, if you enter, a lot of schools and programs of public health have different offerings in relation to career. Part of the degree program requires that students complete an applied practice experience as part of their degree, which is a 200 to 400 hour work requirement. And so with that said, a lot of these schools are equipped with opportunities for students to also locate these jobs or graduate assistantships or research assistantships in-house. So, and that could be through connection through their faculty, through a career center if the school has one. And sometimes a lot of them even have like their own job search boards just for students, and their own community partners and agencies that they work with to just recruit from that school. So that's one method. Now, I also see the question about networking in the public health field when you're not already in it. There are also some associations out there that you could pursue. One is the American Public Health Association, or APHA, that Deborah mentioned. But if you're a student wanting to talk to young professionals and students that are or current students, whether they're in a master's or a doctoral program, I also recommend the Association for Schools and Programs of Public Health. They do have what they call This is Public Health ambassadors that students can go to. They also host virtual events for students that might have questions as well. So that attending things like this is also a form of networking and making connections with folks. So I'll go ahead and post the ASPPH, This is Public Health site in the chat for folks to also consider as you all think about networking.
Thank you. And there was also something in the chat. It says racism is more recently being declared a public health issue, most significantly during the pandemic, BLM movement and rise of anti-Asian violence. Have these declarations really made a difference, and what accountability aspects are being made by these institutions, counties, and organizations that make this declaration? How is innovation and collaboration coming into play?
Can I take or start at least? So I think whenever you have a community that is underserved, underrepresented, stigmatized, otherwise oppressed, the first step, and this is where I do see inroads being made both domestically and in other countries, is essentially revealing these stories of these previously quite invisible people. There's this Jay-Z lyric, you can't heal what you don't reveal. And sometimes, you know, with COVID, there were entire municipalities that weren't reporting the race of COVID, of people living with COVID, for example. You can't address the facial disparities if you don't actually know what they are in the first place. So one is just a information gathering, data collection. The next step is, okay, so what you reveal all these disparities. And I think there is also money behind, okay, if you are going to introduce a program or a policy, be at least conscious of how that policy or program affects different communities of different races differently. So it's going from, okay, completely blind to, okay, at least we're aware and we're conscious. The next frontier, and this is where I see the much heavier lift around the world, is how do you transform the root causes? It's one thing to say, oh, you need more Black doctors because people living in predominantly Black communities, their health is better when there are more Black doctors. Okay, but then why is that? And getting to the root cause of how it is we got to this place, to me, is the next frontier. And that's the much heavier lift. I think we're making progress on the first two, cautiously.
Anyone else want to add to?
Yeah, I agree with Dr. Yam as well, and that noting that like things like systemic change, especially when it comes to social justice and these causes that we care about, but also like things like racism, is going to take a lot of time, and it takes a lot of trust building, and it takes a lot of that collaboration. And so all of those things that Dr. Yam mentioned takes a lot of time in terms of like building trust. And sometimes that could be frustrating, right? Because we want to see immediate change to these systems that we're working with. But also like, you know, in terms of a declaration, the declarations are always just a first step. And like a lot of the good work that we do happens behind the scenes and might not always be communicated to the news or the media. And so what's also important, and I also think like this is also in addition to this next frontier, is how do we communicate some of these changes in the media as like members of an institution, especially as people like us are become leaders in an institution. How can we also be transparent about the progress that we made, and also continue to encourage the communities to hold us accountable as well?
Yes, all of that was great. And I wanted to echo those things and also mention that, like, I guess like some things to look for about like when you're looking at like whether an institution organization is really like doing anything is like just like looking at if they have like any tangible steps they're taking, right? So it's like a community can say that, oh, we're like, we love the community, whatever. But if they're not taking any initiatives to actually put communities first and like ask communities what they need and incorporate them into every aspect of like, you know, the intervention or the research or whatever, then that's not really putting communities first. And so looking into that, and then also like, is there actual funding for like anti-racism work, or are these institutions just like putting out statements but not actually like funding this work or actually providing resources to like Black and Brown like scholars and students? And then another thing, like especially with regard to like scholarship on like Asian American health, is like data disaggregation, right? Like our institutions actually just like saying, oh, like, sorry, Asian Americans broadly like have these health issues, but like we're not actually going to do anything because like they don't even know like what the disparities are, or, like what the inequities are. It's really important to see if there's work being done that actually looks at like specific nuances and experiences like among Asian American groups, and not just like grouping everybody as a monolith with one experience. And so like all of those are kind of like things to look for when it's like, oh, okay, is this institution really like what I'm about, and like somebody that I want to work with. And then of course, like, yeah, like the funding. I think some of like with these declarations about racism being a public health crisis, I think maybe like one of the more tangible things is like there are like a few pots of funding like here and there popping up that, you know, is designated specifically for this work, which is important in like, you know, sustaining like the scholars who like are trying to do this work. But yeah, just like some things to look for.
I'm glad to hear that there's funding for racism. I mean, that there are pots of money coming out. I was just thinking, you know, in terms of maybe like racism that seems more implicit, that like even the way we do research, medical research. And I think to me, that's very troubling because like I have relatives who get sick with serious diseases, and I'm not always confident that the medical research in America is really counting the genetic differences that an Asian or Asian woman would have. So people suffering from like, for example, pancreatic cancer. I just talked to a friend who's a doctor, and her mom has got like stage 4 pancreatic cancer, and she has been learning more from maybe the more international community that there are gaps in terms of research addressing Asian Americans, specifically their type, and their vulnerabilities to certain diseases may not be uncovered because of the way we do research, because we're just not thinking, we're thinking too European or too white, or, you know, like, yeah, we want to help our white, you know, friends, but we also want to recognize that the African American community may have like a certain predisposition to certain diseases, and may need to have research that is more focused or geared to addressing those weaknesses, and therefore a treatment can be more focused and safe. So the way we make drugs, also, you know, just you can see that if we're not taking careful notice of the differences between different ethnicities, it can really, you know, it's really systemic, you know, racism. So I hope that there will be just more changes.
Tammy, any last thoughts?
I think everyone already covered.
Okay. Thank you. We are actually almost at time, so this is perfect. And I guess on a joyful note, because our theme for APIDM is celebrating APIDA voices, what do you have to look forward to celebrate this month and in May and into the summer? So Tammy, you can begin.
Well, for something fun in May, I have 2 weddings to go to, so I'm excited for that. And spending time with family. And I'm seeing family next week actually too, so excited for that.
Next. See, how about you, Debbie? I know you got things going.
What was the question?
Celebration. What are you celebrating? What do you celebrating this May or the summer? Or,
okay, well, I'm going on tour. Well, I'm being a groupie. One of my daughters is a musician, and so she's doing an 8-day tour, and I'm gonna go to half of those concerts. So I'll be doing some traveling in the Eastern Coast, and so that should be fun.
Wonderful. How about you, Sophie?
Yeah, we're doing some traveling with my family, and then also with my friends this summer. And also my parents are getting ready to celebrate their 40th anniversary in June. And so my sibling and I are like looking forward to hopefully planning something for them. So it's exciting.
Congratulations to them. How about you, Dr. Yam?
Oh my goodness, I feel like my life is not my own. It's basically, oh, my kids are, now it'll be soccer season after we just finished, the swim class season. So yeah, I think that getting through another month of parenting and shepherding the young children to the next month, that's my happy place for the month.
Joanne.
Yeah, I think that so fun fact, I'm in a rock pop cover band. And we're actually playing a 4-hour show tonight. And so I'm also like kind of gearing up for that. Debbie, when you mentioned like going on tour, I'm like, ooh, can't relate or can relate. Because it is, I know it's a haul. Also things that I'm celebrating are I just finished watching Beef on Netflix. So good. And then I'll also be traveling to Japan for 3 weeks in May. So I'm also very excited about that trip and can't wait to explore and learn more about the country.
Wonderful, wonderful. Thank you. Thank you again for doing this. I really appreciate it. I learned so much, and I hope everyone in the audience did too. And once we are finished captioning and stuff like that, we'll put the recording on to our YouTube channel for people. But thank you again so much. I really appreciate you. I'm gonna stop recording, and happy Appedum. So last vestiges right there.